The question is, why is your sleep not as good as it could be? As I noted in my previous videos, poor sleep leads to a number of physiological, psychological, and neurological problems. If you want to take your performance and productivity to the next level, you're going to need to improve your sleep. In my previous videos, I reviewed the problems of using sleep medication and alcohol to reduce physiological activation to help your sleep. In this series of videos, I'm reviewing one of the main causes of suboptimal sleep: physiological activation. I'm Dr. Chris Friesen from Friesen Performance, where I help you achieve your greatest potential by optimizing your psychology, physiology, and neurology. So what is physiological activation? This is when the sympathetic branch of our autonomic nervous system is overactivated at a time when we need it to calm down. Today I'm going to cover the effect of nicotine, cannabis, and caffeine on our sleep. We all know that smoking is bad for us. The active drug in cigarettes is called nicotine. Some people are addicted to cigarettes. Other people are now using nicotine as a performance enhancer. When people use nicotine as a performance enhancer, they tend to use lozenges or gums or patches. The research on how good nicotine is at enhancing cognitive performance is mixed. There's some research showing that it improves our ability to focus, our attention. But the research showing that it improves executive functioning and memory is quite mixed, and a lot of studies don't find a positive effect. Nicotine is interesting because it can serve as both a stimulant and a sedative or anxiolytic. It appears to work as a sedative due to the release of endorphins. You're probably all aware of what endorphins are. These often are released when we're feeling strong pain or when we're exercising. It makes us feel relaxed, lower levels of pain, and sometimes positive. As many of you are aware, nicotine is highly addictive. It's less addictive when we consume it in slow-release formats such as gums, patches, or lozenges. Nicotine is addictive primarily because it helps release dopamine in the brain. Nicotine primarily functions as a stimulant. It activates the sympathetic nervous system, the stress response, what is known as the fight or flight response. This is due to the release of epinephrine and norepinephrine. These neurochemicals increase physiological activation by increasing our heart rate, blood pressure, and respiration rate. The use of nicotine, either through smoking or as a performance enhancer, can have negative effects on our sleep. Nicotine has a half-life of about 2 hours. So that means after 2 hours, half of the drug is still circulating in your system. What this also means is that after 4 hours, a quarter of the drug is still in your system. No amount of nicotine in your bloodstream is good for your sleep. It reduces the amount of rapid eye movement sleep, deep sleep, and total amount of sleep time. What about cannabis, marijuana, also known as THC or CBD? How do these affect our sleep? In many states and all across Canada, marijuana has now been legalized. Like alcohol and nicotine, marijuana can also act as a sedative or stimulant. Low doses of THC act as a stimulant, but higher doses it can act as a sedative. This is one of the reasons why many people now use marijuana to help them sleep. It's true that THC reduces how long it takes you to fall asleep. But like alcohol, it tends to block REM sleep. Despite what many people claim, daily or nightly use of marijuana can lead to both dependence and tolerance. So in other words, if you're using marijuana to help you sleep, you're going to develop tolerance and you're going to need higher doses to get the same effect. And similar to sleep medication and alcohol, when you stop using it, you're going to get rebound insomnia. In other words, your sleep is going to be worse than it normally would be. A common situation I see with my patients is that they often stop using sleep medication, alcohol, or marijuana for 1 or 2 nights and have a real hard time sleeping. They mistakenly believe that this means that they need these substances to sleep. But as described in my previous video, any substances that act to either activate you or slow you down, the body is going to fight against this. And when you take this away, there's a rebound effect. Given that cannabis is now legal in Canada, I've experimented with both sublingual THC and CBD oil to see how it can affect my sleep. When I use a combination of CBD and THC, I do perceive that I'm sleeping more soundly. I have fewer awakenings. For the past 3 years, I've also been using an Oura ring to to track my sleep. At this point in time with Generation 2 Oura Rings, we know that the amount of sleep is pretty accurate. The determination of the sleep stages is not so accurate, so I wouldn't rely on these readings. It allows me to track how often I'm waking up in the night. So when I use a combination of THC and CBD, I do notice that there's less awakenings in the night as verified by my Oura Ring. The problem I run into though is the next morning I feel really groggy, and it takes me a while to warm up. This is most likely due to the psychoactive effects of THC. On the nights I've used THC, I've noticed that my heart rate increases and my heart rate variability decreases. Heart rate variability, or HRV for short, is a marker of our nervous system's health and our level of recovery. I'm going to touch on this a bit more in future videos. These are both signs that THC is acting as a stimulant. Some researchers are starting to look into CBD on its own as a sleep aid. Right now, there's not a lot of research on this, so it's hard to make any firm conclusions. I know from my experience, when I use CBD on its own, there doesn't seem to be much of an effect when it comes to sleep. I do notice though that my heart rate does go up a little bit when I use just CBD. Of course, for CBD to be effective, it usually needs to have some THC in it, and I believe it's likely the THC content that's contributing to the increase in sympathetic arousal when I'm sleeping. So far, there seems to be less tolerance when it comes to using just CBD relative to THC, so this is a bonus. But so far with my personal experience, I haven't noticed any appreciable differences in my sleep when I use CBD on its own. But this may be due to the fact of the dosages I've been using. The dosages in research often go into the hundreds of milligrams, which is very expensive. The most I've taken is maybe 80 milligrams. Using higher doses of CBD may have potential as a sleep aid. This is probably due to decreasing anxiety and reducing core body temperature, which is something we need to happen in order for us to get good sleep. Caffeine is the world's most used psychoactive drug. Caffeine on its own doesn't seem to have any real health benefits, but in caffeine-naive subjects, it does tend to increase some cognitive abilities such as your attention. Most of the benefits that we hear of caffeine is due to the beverages and foods that they're found in. For example, coffee, tea, and chocolate. Unfortunately, caffeine has a negative impact on our sleep. As I noted in my previous videos, caffeine blocks adenosine receptors, which basically prevents drowsiness. Caffeine has a half-life of about 5 to 6 hours. Of course, this depends on our genetics. Some people are fast metabolizers, and some of us are slow metabolizers. What this means is after ingesting, say, 200 milligrams of caffeine, after about 6 hours, there's still 100 milligrams of caffeine circulating in your system. After 12 hours, there would be about 50 milligrams still circulating in your system. So if you had a coffee with about 200 milligrams at lunchtime, by midnight there's still going to be about 50 milligrams of caffeine in your system. What we know is caffeine reduces your deep sleep, the restorative sleep. As I outlined in a previous video, caffeine blocks adenosine receptors, but the adenosine is still building up in your system. So we often get a crash when the caffeine starts to wear off and the receptors are reactivated. Then we tend to feel extreme drowsiness and a strong pressure to sleep. So for most of us, we should really avoid consuming any caffeine by about 1 o'clock in the afternoon if you want to improve our sleep. If you're having trouble sleeping, seriously consider cutting back on the amount of caffeine or cutting it out altogether. When we use caffeine in the morning, it's really just reducing the withdrawal effect. It doesn't have a strong effect on our cognitive performance. In future videos, I'm going to talk more about the strategic use of caffeine as a performance enhancer. What I'll say now, in order to get the beneficial effects of caffeine, you need to not consume it on a daily basis. In the next video, I'm going to focus on how evening exercise, meals, and what we focus on negatively affects our sleep. I hope you found this video helpful. Please like and subscribe if you want to get more content like this. Until next time, keep moving forward.